Hello, I will be going through the questions this week. This is the new VIP site, so yeah, we have a bunch of improvements to the VIP section. There's going to be a lot of exclusive content on the Self-Hacked website for VIP subscribers alone, and there's going to be other benefits. So we're making the VIP section a lot better. Let's go through some of the questions here. Is coconut oil and saturated fats bad? I thought they were good for cooking foods. If I go on a keto diet, should I not be eating saturated fats? It's all very confusing now after you're reading posts that saturated fats like butter and coconut oil cause fatty liver. So the answer to this question is I would... If you eat excess saturated fats, there is some harmful effects. It can cause fatty liver, and it can cause LPS and endotoxins in the gut. It's not very good for the gut bacteria. So I don't recommend a high saturated fat diet. Now, you still could do a high fat diet. I do a relatively high fat diet. I just consume a lot of olive oil. So if you're doing a keto diet, fill up on the olive oil, minimize the saturated fats, and keep in mind that there is saturated fats in olive oil as well. So you could use some ghee if you wanted, but again, I personally try to stay away from saturated fats. It makes my LDL cholesterol skyrocket. And when you have higher LDL cholesterol, your mortality goes up. So you can check your LDL cholesterol in lab test analyzer, see if it's in an optimal range. That's number one. If you don't have any gut problems, or and you're keeping track of your gut microbiome, then that's number two. You want to make sure that you have a healthy microbiome. And number three, you want to, there's no way to really check a fatty liver, but if you're thin, then it shouldn't really be a problem, or if you're losing weight on it. But either way, olive oil is going to be healthier than saturated fats. So for some people, it's okay, even in higher quantities. For some people, it's not okay. For me, it doesn't. I don't notice any harm from ghee in the short term. I feel fine, but my cholesterol goes up a lot, and I just don't consume it. Okay. My self-decode says I respond worse on high-fat diets and saturated fats. Can I go on a keto diet or a carnivore diet? Go on a high olive oil diet. That's what I'd recommend. I have been advised by my functional medicine doctor to try keto. You can do keto with olive oil. And also, upon my discussions with you, when you used to consult, you told me to eat meat during the day and stop gluten and dairy to bring down inflammation. Okay. Do I need additional supplements to process fats in my body? No, that shouldn't be a problem. Again, I would go with, I don't think it's the supplements. Usually when they're looking at saturated fats or high-fat diets, they're looking in response to weight and some other metrics, rather than the digestion of fat itself. I have inflammation, neuropathy, chest, neck, shoulder, arm tightness, neuropathy. I don't really understand self-decode and all the sniffs, what to look for, where. Is there any help consultation provided regarding getting the most out of self-decode? I'm lost and I don't understand that Suggestions provided are specific to my case or they're general for everybody. Can I consult with somebody from the self-hack group regarding my inflammation issues? I feel my immunity is very low because I seem to get sick very often. Is there a cold viral infection prevalent? I'm always the one to catch it. Okay. So first of all, with regard to self-decode, if you're not understanding, some of the broader features that we have in self-decode, I would recommend that you look at the wellness reports. So let me go show you. If you go to selfdecode.com and you click on wellness reports, you will see 7 wellness reports on it. There's an introductory one, there's a mood one, the sleep, vitamins, cardiovascular, inflammation, and very soon there will be a minerals one. That will be coming out in a few days, so by the time this is out, it'll probably be out. So those are good ones to start with. Those are very, very simple ones. You could read about your genetics, learn some information there. We also have a symptoms analyzer. So if you've got neuropathy, I would type that into the symptoms analyzer and see which SNPs that have risk alleles that come up. What else would I do? I mean, there's a lot of features in self-decode, but those are some. The health categories is also decent, and relatively simple. So I would use that as well. In terms of getting a consult from anyone from the team, we did offer, consult with 4 people from the team. Well, no, it was I gave 2 consults, and then we had 2 other people give consults from the team. Meaning 1 person from lab test analyzer and 1 person from self-decode. We still can do something like that if you're having trouble understanding what your situation is. You could ask questions here. It was a limited time thing that we did it for, but since you're a VIP member, we could do it. I would email support. I'm not 100% sure of. Yeah, consults really they take a lot of time, and it's really hard to do that. And it's hard if people have tough cases. Sometimes it's hard to get other people to take their cases on. So that's why I have to be part of the consult process. And my time is limited, so I'm not sure. I'm not sure exactly what we can do there right now. But I would look out for. Let me see. What are your issues here? You have inflammation, neuropathy, chest, neck, shoulder, arm tightness, and neuropathy. Okay. Okay. So I'm just thinking about the consultation. Okay. I'm not sure. We had the special package. I don't know if we can offer that right now, but you can ask questions here. And like I said, we're doing some things for the VIP. Like, for example, soon only the people in the VIP will be able to comment on self-hacked, and before we used to not answer comments because it just would take a ton of time. But now, since people are part of the VIP who are going to be commenting, we're going to answer every comment. So that's one way. Comment on posts, read around. Like I said, we read all the wellness reports, see if you could find anything in there. The health categories, and use the symptoms and conditions analyzer. And then I would also use self-decode as well. You can see which markers are out of whack. If you're still having trouble, I would email support about doing a consultation. So that's support@selfhacked.com. The other thing is we're also going to be doing group consults in the VIP. That's something that we're going to pick up. So if you wanted to do a consult in a group setting, it'll be public, but you don't have to give your real name or anything. So it's not going to be public information. Hello, Joe. I'm 78 years old, and I have environmental sensitivities. So mold, pollen, for the past 40 years. Okay, and officially diagnosed. This condition is sometimes called environmental illness, multiple chemical sensitivity. For the past 5 years, 24/7 symptoms have included lightheadedness, dizziness, severe fatigue, and weakness. When I react to something, these symptoms intensify and are joined by nasal stuffiness, drowsiness, sometimes progressing to falling asleep. Let's see, brain fog and premature ventricular contractions. I have histamine intolerance. Okay, also have adrenal insufficiency and take hydrocortisone. I've been able to manage my sensitivities over the years by avoiding chemicals in a food that I react to as much as possible, using eco-friendly products, using a 4-day rotation on my diet. Okay, I have your cookbook on lectins and inflammation. Try to follow, but I could definitely do better. I also have a course on inflammation. I have your course on inflammation. I'm going through now. I considered getting the PEMF instrument you recommend, but I'm concerned the EMFs will aggravate my PVCs. Honestly, I wouldn't know if PEMF would exacerbate premature ventricular contractions. That's not something that I would know. Let's see. Yeah, I mean, I've had a lot of clients with these issues in the past, and these are tough problems, definitely, because a lot of chemicals can set these issues off. So, as you already know, bringing in a very clean environment is important. And being outside as much as possible is really important, because the indoor environment for some people is just not it's just not meant for some people. You have VOCs, mold. I mean, these things just grow indoors in low concentrations. At least mold and VOCs, is used in a lot of furniture. So just being outside in a clean area is your best bet. I don't think I got the email that there was not a group consult on the Facebook Elimination diet page. I was told on the page there was an email sent. What is the schedule for these videos? So you want to look in your spam folder. Sometimes it goes in the spam folder, and if it's not in the spam folder, then email support@selfhack.com to be put on the list. What is the schedule? Thank you. How can one use high maize unless you're eating other ingredients besides meat or fish? How can one use the high maize? I'm not sure what the question is, but right now the way I use high maize is I just put lemon juice. You can put honey, raw honey, some lemon juice, and add water. Um, or you can get ready-made lemon juice. Uh, or yeah, in terms of the schedule for these videos, I'm not sure myself exactly what the schedule is going to be, but we are going to be having them. So the new VIP upgrade is something that's been recent, and you're gonna see a bunch of new features, including a lot of new posts on Self Hacked, and also that are only VIP. There's going to be a lot of bonus content for VIP, and um, there's going to be other features as well. Let's see something. I'm just gonna putting in my charger here. Okay. I would like to clarify a few points on Th1, Th2 cytokine. DHEA and androgen excess implies the Th1 dominance. Okay. Glucocorticoid excess to DHEA means Th2 dominance. Th1 Th2 ratio is equal to Th2 to DHEA to glucocorticoid. All right. 3. Menopause aging in women leads to excess Th2 shift from the Th1 to Th2. Am I right? Let's see. So menopause. Okay, so first of all, let's backtrack here. There's a lot of things being said. I don't think this is true that Th1 that DHEA and androgen excess implies Th1 dominance. I don't think that's true. Also, they're somewhat. I mean, they might correlate somewhat, but they're also independent. Glucocorticoid excess to DHEA means Th2 dominance. Again, that might be true because glucocorticoids suppress the Th1 system, but it's not necessarily true. Meaning, there might be a correlation. I'm not sure offhand what menopause does to the Th2 excess Th2 shift from the Th1. I'm not sure what it does offhand. I'd have to look that up. Is IL-6 a Th2 cytokine? It's somewhat of a neutral cytokine. It's not Th1 or Th2. But if it's one of them, then it's Th1. Arachidonic acid increases menopause since COX-2 PGE2 increases. I don't know. I'm not sure what you're asking there. Okay, Jim asks, also responded very positively to... Oh, here. There's an initial part. I get a relaxing and centered feeling from using LLT and ISIS on stomach. respond positively to H1 and H2 antihistamines, had virtually no success on various elimination diets from SIBO, histamine, and salicylate issues. Constant moderate severe brain fog, react to virtually all food. All my symptoms are exactly the same as the hyperinsulinemia symptoms on Wikipedia, but are permanent and get worse when I don't eat quickly enough in the morning. Consume things which are high in the glycemic index, too big of a meal, or not with fat and protein. I do better off. Plant foods respond positively to rhodiola, schizandra, L-theanine, holy basil, cinnamon, fish oil, magnesium, niacinamide, 5-HTP, CBD paste, benzos, cromolyn, TGL, licorice, fluoxetine, Chinese skullcap. Okay. Best response is in order of cognition. Okay. What would be the best course of action moving forward? So benzos pretty much stopped my food reactions. 5-HTP had the best influence on ability to socialize and interact with people. Brought me back to 75%. What do you think this could be? HPA axis dysfunction, oxidative stress in the hypothalamus or limbic system. So, given the information that I have here, every supplement and drug that you do well with is either doing one of three things. It's either lowering cortisol and calming the nervous system, it's increasing serotonin, or it's increasing GABA, essentially. And that means that there's a psychological and neurochemical component to what's going on. In terms of, yes, you do have HPA axis dysfunction. There is problems with the limbic system. There might be oxidative stress, but the issue is more of a neurochemical imbalance. That is, yeah. I would actually look at the mood report, the genetics mood report, because we look at a lot of neurochemistry in that report, and we have gene-based recommendations there. But all the stuff that you're listing here is either targeting GABA very strongly or serotonin. So it's clear that you have a neurochemical issue, or it's targeting the HPA axis. So cortisol, CRH, cortisol, things like that. You want to definitely, you're already doing a lot of things that are effectively calming the nervous system, increasing serotonin and GABA. So I think that is what you want to focus on. Hi, Joe. Also curious about your thoughts. Okay. Seeing as you no longer do consults, you said to ask to be put on the waiting list last time. When I emailed support to do this, they said you don't offer them anymore at all. I'm probably going to tell support to change that response, that there'll be a waiting list. Because, I think there should be a waiting list. Because at some point, I probably will do them. It's just now I'm not doing them. So that's why they're saying that. Can you recommend some good doctors to work with, preferably who are down with your line of thinking, genetic testing, and possibly even using some of the tools like lab test analyzer and self-decode? I'm in Australia, but seeing most doctors do Skype consults these days, I guess we could work around that. If you could provide at least a small list of doctors you know like this, who have space open possibly, would really appreciate it. Honestly, I don't really have any doctors who I don't have any doctors who I would recommend right now. Um, yeah, I really, let's see, offhand, no, I don't really have any. I don't have any doctors who I'd recommend right now. Um, the doctors using genetics right now, they're not doing it right, which is a place that I'd like, I'd like Self Decode to. We want to really start teaching doctors how to use it, and same with labs. I don't think they're analyzing labs correctly. These things are quite complex, and um, yeah, I don't. Sorry, I don't have any recommendations, but I will tell people to put on the waiting list. Hey Joe, also curious about your thoughts of implications for disease being created by the new rollout of 5G technology. Honestly, I don't know enough about the 5G technology to know how bad it is. There's definitely a lot of people who say it's terrible, but I haven't seen any science around the topic. Um, yeah, I mean, there's a lot of nonsense out there about everything, and I like to see the science around things before I come to a conclusion. I did not happen. I mean, again, I didn't have a chance to do research on 5G, the health implications. Maybe that's something a topic we'll write about for the VIP members. Hi Joe, is the elimination diet supposed to start out as a keto diet and then change to non-keto as food is added? This is never explained in the diet course. Can you discuss the side effects and how to deal with it? I have a headache and can't tell if it's exacerbated by the diet or is caused by something else. Are you ever going to do a webinar on interstitial cystitis? This disease defies all attempts to fix it. There's varying causes. Okay, so let's start with your question. Is the elimination diet supposed to start as a keto diet? Not quite. Um, we wanted to do the elimination diet to include first as little foods as possible. So, I mean, yeah, just to take out any kind of variables. Um, so, for example, there's yeah. So you would start with a meat, a protein, such as like beef or something like that. And if you're reacting to beef, then that's you're probably just not doing well with a high protein diet or something. Um, but it's not starting out as a keto diet. No. A keto diet generally wouldn't be so bad to start out with because it's a lot of fats, some protein, and not very little carbs. So it wouldn't be a bad diet to start out with. But the elimination diet goes a little further, and it's just trying to go through one food at a time until you could, um, until until you see what is giving you negative effects. So a little hard to start it, but I think it's the best way to start from a more narrow focus and then broaden the foods that you can eat. Hi, Joe. I would like to know if grapeseed extract, pine bark extract inhibit Th2 cytokines like IL-6. They do inhibit IL-6. Um, and in general, they're Th1 stimulants. For many years, my iron levels and vitamin D are always low. Continually living on supplements. Notice my family members don't take vitamins and yet don't have this problem. I read one of your posts that people with inflammation always have low vitamin D, low iron, and low pregnenolone. How can this problem be fixed, and how can I get rid of this persistent inflammation without living on vitamin supplements for the rest of my life? So when it comes to vitamin D, first of all, you should be getting more sun. I don't know where you live. Number two, with iron, you have to make sure you fix your gut inflammation. And with a lectin avoidance diet, you should notice your iron levels go up. So you should be more on a animal food diet, more meat-based diet, and your iron levels will go up. And a lectin avoidance diet in general. If you're having low iron levels, then again, it probably has something to do with gut-based inflammation. Low pregnenolone levels. That I'd like to see how low they are. You could put these markers in lab test analyzer, and that will give you an idea how low they are. For many years, my B12 has always been high in the 4-digit sky high. No one seems to know why. Is there any health condition associated with elevated B12? You're probably taking any kind of supplement will elevate B12 by a huge amount, even if it's something that is like fortified with B12. So I would make sure you're not supplementing with B12. That just in a food you're eating. Could be a protein bar or anything. There's a lot of things with added B12. I read your post about your past health problem. My situation seems to be very similar, having lots of food sensitivities. Why is it always in my head? Let's see, I want to be able to eat most everything again since I'm not allergic to anything, and I want to know the root cause of my inflammation. Food seems to be causing my inflammatory pain in my head continually. Well, the thing is, the way the inflammation works is you generally have some kind of weak spot. It could be an autoimmune condition, a specific one, or it could be an injury. And when you get inflammation from something, it hits that spot more than normal. So in your case, it could, you might have a specific place in your head where the inflammation you have, it might be a weak spot where maybe you have some inflammation already, and then when you eat something, that's where it flares up. Okay. My wife and granddaughter have both been diagnosed with SIRS. My wife's family is fraught with SIRS-like health challenges. What I have not been able to determine is, will other family members present with the same multi-susceptible and CFS HLA-DR genetic results if they are tested? In other words, will this be a family-wide pattern, or will variations on the CIRS theme be likely if they present with CIRS at all? Do you agree that people with CIRS-related genetic patterns have genetic connections primarily to Northern Europe, perhaps Ireland, Scotland, England, Germany being epicenter? Honestly, I have never really the whole genetic thing with CIRS is something that has never been validated, and yeah, it's a bit of a problem because every single mold client that I've ever got the test, and they were 100% positive on the test. I never had a single person who was negative. Now, you might say that, oh, that, validates the test. But on the other hand, there is no test that's 100% like that. If you're seeing, first of all, it's a test that's like not simple to, you need a whole, you need tools to like decipher what it means. It's not a clear result, right? And what I suspect is that everyone essentially has a form of one of these variations, these genetic variations, and yeah, I mean, everybody comes back and tells me I have this dreaded genotype. I'm very skeptical. It's I don't know what the variations are in the population, and so that's something that I'm very skeptical about, and I would want to I'd want to know that. That's something that that's something that I would I would like to try to get the data on, if there is any data, and I don't think there is. Um, yeah. So the answer is that if you did a blood test, and you're perfectly healthy, my bet is, and you went to a CIRS doctor, my bet is that they'll tell you have some form of genetic susceptibility to CIRS. That's my guess. Now the question is this a family-wide pattern, or will variation thing present? I don't know the population frequency of the CRS, this haplotype. Okay. But I would like to see the scientific studies as to the frequency of the haplotype in the population. In any case, moving on. Hi Joe, for biofilm disruption dissolving protocol, how do you suggest to combine the supplements? Okay, is it better to rotate them? So there's a list of biofilm disruptors. I would not rotate them. I would take them together. My question about biofilm is, how can I combine these compounds without doing damage? I know, for example, that nattokinase and lumbrokinase, serrapeptase, and AC are blood thinners. That's true, they are blood thinners. Are there other supplements that may have interactions, like magnesium, DHA? I currently take only magnesium. So DHA is also a blood thinner. Fish oil, in general, if you're generally taking fish oil, that's the EPA and DHA. These are blood thinners, and nattokinase is a blood thinner. The other blood thinners are not a problem unless maybe you're taking a drug like warfarin, a very strong blood thinner. But a lot of these natural products in general are blood thinners. I wouldn't be worried about having too thin of blood unless you have some medical condition or you're taking a blood thinning drug. Garlic is a blood thinner. Let's see. Yeah. So the question is about interactions. I don't think it's any problem to combine the supplements um, as long as you're not on any blood thinning medication or you don't have extremely low platelets. In your blog, there were several reasons for people experiencing brain fog. How did you step through the process of determining what your cause was? Trial and error, and also genetics. Um, Hi, Joe. I was wondering what your thoughts were on the Beck protocol. One second. Okay. I was wondering what your thoughts were on the Beck protocol. I am 41. Honestly, I don't know the Beck protocol. Something. I don't. I don't know the Beck protocol. That's the truth. Um, but let's see. How do the devices relate to ISIS, PMF, Earth Pulse? In terms of these devices like PEMF, I would only use a device by micropulse, such as ISIS, because Dr. Bob uh, Dennis, he's been researching these things for a really long time, whereas these other people are not really researchers. Um, yeah, so my personal approach would be, um, the new M1 device that they have is that has a lot of different protocols on there. You have a Schumann resonance. There's a lot of different protocols that you can do there. So it's a pretty adaptable device. I personally only use the ISIS. So I don't know about the other ones. Um, there's a lot to experiment with the ISIS, and that's what I'm trying different experiments now. Hi Joe, I've recently developed nonstop brain fog. In October, I've had the symptom for 3 straight months. It's been really debilitating. I've read your article on brain fog and recommendations. I'm curious if you had more in-depth information on recovering from brain fog, or could tell a bit more about your recovery story. I really am working hard to get out of this fog. It's not easy. It's hard that you found your way out of it and would love to hear more. As an aside, I do have thyroid issues. Um, let's see. So the question here is if you had more in-depth information on recovering from brain fog. Um, we don't actually, we don't, I mean, the things that I've done, a lot of that stuff is, the main stuff is in Self-Hack Secrets. That's what helped me. And, it's just the top healthy stuff that you can do. Um, and then there is some gene-based stuff you can do. Again, the mood report is a good report that we released on Self Decode. I would recommend that one if you wanted. Again, that deals with like neurochemistry and some other things, but it sounds like if you've developed it nonstop in October, it seems like this is something related to either an infection, um, or a neurochemical imbalance. I mean, either, well, if it's an imbalance, it was probably precipitated by something. Sometimes it's precipitated by drug usage, sometimes by a stressful event. Um, so the question that is the most important question is, what do you think may have precipitated this brain fog? Since it is sudden, you have to ask yourself that there's not that many options. It's either a toxin, infection, um, or extreme stress, or a combination of what I'm saying. Um, and yeah, it's likely not something. Again, it depends on what you had before. But if you just had no issues before and now you have a bunch of issues like nonstop brain fog, then it has to be something somewhat acute that you've experienced. Um, Either that or it's a combination of events that happened. So I don't know exactly what thyroid issues you have, so I can't. It doesn't really give me that much more information.